just sit on? Where is it? Where's my harmonica? It's not here!
You asked for it, and I'm delivering more educational reactions to one of your faves. Family Guy number 4 coming at you hot. But before we get into it, if you're new to my channel, welcome. My name is Dr. Jordan Wagner. I'm an emergency room doc. If you enjoy the educational reaction videos and other stuff that you see here on this channel, please smash that subscribe button and turn your bell notifications on. That way you learn when I post a new video. All right, let's dive right in.
You know what? Hang on. I left my harmonica in the tub.
I think Peter's in there taking a bath.
Son of a bitch! What the hell did I just sit on? Where is it? Where's my harmonica? It's not here!
Peter, have you seen Stewie's harmonica? It was in the...
Of course.
Oh my God. It was in the tub, and now it's in my butt!
You know how many times we get in the emergency department, somebody comes in and they sat on something and it went up into a certain area? It's pretty hard just to sit on something. You need to be able to relax the muscle. The sphincter, which is the muscle around your butthole, it's tight.
Stewie, Daddy needs your tiny hands for a very special project.
Tiny hand. Oh my gosh. You can attempt to get it out. It is very painful. Sometimes you can get it out in the emergency department. Sometimes you actually have to go to the operating room. At the hospital, there's the harmonica. We do get x-rays looking for alignment, looking to see how far up it is with the orientation, those sorts of things. If it's too far up to where you can't reach it with your hand, you have to go to the operating room. Or worst case, they have to actually open you up.
Can we address my husband's situation?
Well, the harmonica's up there pretty good. Unfortunately, removing it would require a very expensive surgery that's not covered by your TGI Fridays gift card.
Oh my gosh. Potentially an emergency because of risk of bowel perforation, but a harmonica could get snagged, can cut.
I don't know. But suddenly it smells like John Popper in here.
That was me. I got musical farts. Holy crap.
Holy crap.
I will not allow this opportunity to go to waste.
Don't put anything up there, like I always say, without a string or a big flange.
We should start by checking your reflexes.
Ah!
That is not what you mean by checking your reflexes, okay? Checking your reflexes, your DTRs, your deep tendon reflexes. That's when the doctor used the hammer. The classic places like the knee, the patella tendon. You can even do it on the forearm, for the wrist as well, but not just trying to scare somebody.
But you gotta help me. My arm really hurts. It all started after I got a chainsaw.
Is that right? Well, it sounds to me like you may have chainsaw elbow.
Okay, no, there's no such thing as chainsaw elbow. What they're describing most likely is tennis elbow or golfer's elbow, which is medial or lateral epicondylitis, which is just inflammation of the tendons in those anatomical positions.
Chainsaw elbow?
So how much synthetic opioid do you need?
That is so messed up. Basically, the best medication for this would be an anti-inflammatory, which is ibuprofen. Opiates in this setting just covers up the pain and actually doesn't fix the problem.
I'm trying to prescribe enough to earn a fanny pack.
I don't have any specific medication, brand, generic versus trade. I think the only thing nowadays that pharmaceutical companies actually end up doing is educational teachings with maybe a dinner or something like that.
Have you ever had a chiropractic adjustment?
What's that?
It's a procedure where a guy who couldn't get into medical school tries to rip your head off.
That's messed up. So chiropractors are their own specialty. They not just crack or realign people. They also do wellness and health optimization. They go to school for a long time as well. They chose this career. They did not make it into med school.
It's kind of like the Polar Express.
Let's do it.
Okay, I'll give it a shot. But this type of thing is usually done in strip malls next to a Little Caesars.
Unless he was trained on a separate course that he took on his own, he shouldn't be doing this. He needs to know these techniques. We spend many, many, many hours learning how to do this. Oh gosh. Oh my gosh. Oh, that's not how you do that. Horrible.
Holy crap, what happened?
Well, I think we simply found your true height.
Okay. So you can actually do cervical decompression basically by pulling on somebody's head, by lengthening it. So it takes some of the pressure off where the nerves are coming out, which could be causing compression of the nerve, which then can be causing symptoms to your extremities and your pain and that sort of thing.
Got you now, bat dame.
Okay. So bats could carry rabies, okay? And their bite is so sharp that you may not even notice it if you're sleeping.
What is it? Ah!
Oh! There's always the potential that they might have bit you. The concern though is it could, and if you get rabies, it's pretty much deadly. What ends up happening is you would go to the emergency department, and if you know where you got bit, you can get immunoglobulin to protect you, and then you would also get the rabies vaccines.
Peter, what the hell did you do to Stewie's hand? It could be broken.
Oh no.
I didn't mean to.
You're trying to hit the bat.
Sometimes I don't think before I act.
Stewie needs an x-ray of his hand to see if there's a fracture, and then we did see some blood, so is there a laceration that needs to be repaired?
Good news. Stewie's hand looks fine.
Oh, hey, high five.
And in kids, depending on their age, not all of their joints are totally formed, so there's a lot of cartilage that is still there that you can't see on an x-ray that it will future form into a bone.
Stewie hasn't had his vaccinations yet. Should we take care of that?
Well, I suppose so.
Oh, but first, I'm required to have you read this pamphlet about the risks of
Yep.
vaccinations.
Possible side effects: fever, severe allergic reaction, muscle and joint pain. Wait, and this can't be right.
A lot of good things about vaccines. Vaccines are not without risk, okay? There's always a chance of something happening. Every human is different. We all have potential different reactions, but risk versus benefit.
Hey, man, how many questions your lady asked?
Oh, geez.
Million?
But I don't remember having to read any of this when Chris and Meg had their vaccinations.
Well, that was before internet chat rooms made everybody an expert.
Well, okay, so that was a big dive into vaccinations, especially now what's going on in the world. So vaccinations are a good thing. Vaccines have been developed to help eradicate a lot of different viral issues that we've had in the past.
What are you boys doing up there? Get off the
nice.
roof!
Go back in the house, Lois. We're being jackass. Okay, ready?
All right, we're rolling.
I'm Peter Griffin, and this is Shopping Cart Roof. Roof Shopping Cart.
Nice.
Okay, go.
Oh!
Ow. Ow.
Oh, broken back. Oh!
God, are you okay?
I don't know. What does it look like? What do I do?
Don't do anything.
Is that? What did I feel, Chuck?
That's your neck.
Fine, dude.
Oh my gosh.
Picked up a bunch of notches.
I'm scared. I'm scared.
my gosh.
I'm scared.
Upper cervicals typically have to do with your arms, right? And your neck. Both are moving. They're moving well. Probably hasn't caused any neurologic problem. It's more structural problem. This is hilarious. I obviously never seen this unless the head is decapitated off. It almost looks like an internal type decapitation.
I'm scared.
Oh, and it just vomited everywhere. It's so gross. Pain, anxiety, these things can cause vomiting. You see it very often.
Does this get fixed with ice or heat?
Ice now, heat later.
That's true. Ice or heat, right? So in this circumstance, though, heat or ice, drop both, get to the hospital, get to the emergency department ASAP, like 911, get in the car ASAP, and get seen immediately. You need a neurosurgeon, you need an orthopedic surgeon, you need a trauma surgeon, you need an ER doctor. All of these docs will show up and really work together to figure out how we're going to put this neck back together and make sure that there's no other major injury that's going on.
What are you, nuts? I got no special
We're at a bar.
talents. Well, what can I do that nobody else does?
Well, you just ate my tip.
Oh,
I got it.
what is he going to do? What is he going to do? All right.
Oh my God, Lois! I can't see!
Uh-oh. So a lot of times when I've seen patients where they literally just can't see, it's actually due to diabetes or sometimes brain tumors. So definitely needs to be seen.
How about now?
Nope, nothing.
Well, that makes me feel much better. You can't see the spaceship either. My cousin Marshall
Oh my
insists
gosh.
if you look past the picture, you can see us.
Normally you'd use an eye chart, but even then, if you can't see the letters in the eye chart, then you use big objects, then you check if you can see waving objects, and then can you see light or not?
Can you please just tell us what's wrong with my husband?
Oh, yes. Well, you see, after ingesting such a large number of metal coins, Mr. Griffin appears to have succumbed to nickel poisoning, causing him to lose his sight.
Oh my God, Lois, I'm blind as a bat. I can't see a damn thing.
The likelihood that the nickel from the nickel is causing blindness is pretty rare. It causes a lot of other things, more GI symptoms, skin symptoms, maybe some neurologic things, but it doesn't typically cause eye blindness. Some other toxicities could. Thank you so much for watching. I loved it. This set was awesome. Let me know in the comments what other things you want me to react to, what other scenes. As always, make sure you subscribe and turn your bell notifications on if you want to see more fun videos like this one. And check out my Doctor Reaction series right here to catch up on the reviews of your favorite shows. Thank you so much for watching and stay healthy, my friends.